In this video, we will see together what are the guidelines or international recommendations. So what is a guideline? A guideline is a treatment recommendation for a given disorder issued either by national or international authorities. The best known in Europe are probably the NICE guidelines from United Kingdom, and in North America, the CADRA from Canada. The main philosophy of the guidelines, so regardless of the disorder, is to offer health professional, in this case ADHD, guidelines to follow when they are confronted with a patient who they suspect has this disorder. They are also intended to help patients and their relatives to learn about the disorder and to help them communicate with caregivers. Although the guidelines were originally designed and written by mental health professionals, more and more guidelines consider the opinion of other people involved in the management of ADHD patients. For instance, the CADRAs were written jointly by pediatricians, psychiatrists, psychologists, primary care physicians, pharmacists, nurses, and educators. Most are mindful of conflicts of interest with pharmaceutical companies of the authors of the guidelines. Overall, these guidelines are more similar than they differ, and all have one goal, that making mental health professionals, patients, and their close relatives better aware of ADHD. So you have understood it? The guidelines are lines of conduct to follow when faced with a person who has ADHD. But in summary, what is in these guidelines? First of all the guidelines start with generalities which should be known to specialists wishing to treat ADHD. Prevalence, frequency of the disorder in the general population, heredity, risk factors like environmental risk factors, evolution of the disorder, and so on. Most guidelines agree on the fact that the diagnosis should be made by a specialist trained in ADHD, psychiatrist, psychologist, or other mental health professionals. And they recommend that the information from parents and close relatives should be taken. The CADRA, however, propose that the diagnosis can be made in the event of an uncomplicated ADHD by a primary care physician or other health care provider. All national or international bodies propose to investigate the impact of the disorder in the different areas of the person's life, as described in the Module 1. Generally, the diagnostic methods are mentioned, so criteria, questionnaire to be used, and so on. Ideally, a treatment plan according to age should be established, involving the patient, but also the school, the universities, other health actors, and family members and relatives. Is it the same for children, teenagers, and adults? Overall, the guidelines separate children and adolescents from adults, both for the diagnosis and for the care. They place on the whole more emphasis on helping parents and families, so like psychoeducation of parents, with the aim of increasing their skills in the management of the child suffering from ADHD, as well as environmental modifications, in order to improve and restructure daily life before the introduction of drug treatments. While in adults, drug treatments are proposed faster. Some age-related specificities also exist in the guidelines, such as considering as far as possible the child's point of view in the diagnosis. All the guidelines will then discuss treatment options, ranging from nutritional advices, for some, to various drug options and psychotherapeutic approaches. Several chapters are generally devoted to drug treatments, highlighting how to introduce them, when and at what dosage, for how long, what monitoring should be done before and during treatment, what are the side effects to be aware of, and how to start the treatment. It is important to consider, moreover, the usefulness of continuing the drug treatment or not. Regarding psychotherapeutic approaches, cognitive behavioral approaches are recommended. Finally, it should be noted that certain specificities exist in certain guidelines, such as emphasizing socioeconomic factors or comorbidities. Some, for instance, such as the NICE guidelines, highlight certain point of views or vigilance, such as being careful to look for ADHD in a child with oppositional defiant disorder, or in an adult or adolescent with a substance abuse disorder, or even mention that the disorder is often underdiagnosed in girls and women. Others also mention what not to do or advise to relatives or patients with ADHD. We strongly encourage you to read them as far as possible. So, We have seen that the guidelines are recommendations made by mental health professionals to other caregivers taking care of people with ADHD. And you also seen that they are aimed at the patient themselves and their relatives.